Good morning once again. Let's get started. Welcome to Selecting Effective Evidence-Based Strategies for Substance Misuse Prevention with Chris Reed. This presentation was prepared for the Great Lakes PTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The opinions expressed in this webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services. Got a few housekeeping items we want to share. If you have technical issues, please individually message me, Rebecca Buller, or Nicole Augustine in the chat section. If you have questions for Chris throughout the webinar today, please put them in the Q&A section. That way we won't lose them as the chat scrolls by, and we want to be sure to answer your questions. If captions would be helpful, use your Zoom toolbar near the bottom of your screen and choose Live Transcript. AI note takers are not allowed in our trainings, and so they will be removed from the webinar. Certificates of attendance will be sent via email to those who attend the full session, and it can take up to 2 weeks for those to arrive in your email. And now I'm going to turn things over to Chris, who is the co-director of the Great Lakes PTTC.
Great. Thank you so much, Rebecca, for getting us started. Hello, welcome everybody. I'm going to go ahead and share my screen. All right, I'm thrilled to be here with you today. We have 3 different areas that we're going to touch on during our session today. One is we're going to take a good long look at steps to selecting substance misuse prevention programs. We can talk about effective programs and strategies all we want, but if we don't select the one that is a good fit for our community, it's not going to be helpful. So I want to make sure we have that in our back pockets before we move on to looking at actual online registries for effective substance misuse prevention programs. And then we're going to talk about how to put that into action. So I'm curious, before we move on, this is the 5th webinar in a series of foundations in substance misuse prevention topics. We started with Prevention 101 back in, I believe it was October. Yes, October. Then we did protective factors in November, risk factors in December, what does not work last month. And now we're on to selecting effective strategies this month. So I'm curious, if you could go ahead and put in the chat, have you been to any of those? Put 0 if you've been to none, which is just fine. You're welcome to join in at this point. Or if you've been 1, 2, 3, or 4 of the other ones. All right, let's see. It's a real mixture, some 4, some 0. All right, and a lot in between. All right, let's see. A few more folks are still chiming in. All right, good to know. Thank you, everybody. So it looks like a real mixture. We got 0 to 4 and lots in between. So thank you for sharing that. If you had registered as of yesterday morning or midday or so, depending on your time zone, you would have received an email from Rebecca with a link to the slides that you can download, the slides that I'll be presenting today, as well as also the online registries guide that we're going to be talking about today. So if you don't have that handy yet, I recommend going and getting that online registries guide. Rebecca just put it in the chat, the link to it, is that we're going to be using that quite a bit today during our session. All right, and just one more thought in terms of what we will be doing today. I do have some individual activities that you'll do, so really putting the information into action right away. So just be prepared to do some individual activities as we are going along. All right, so let's make sure we're on the same page with a few different definitions when I'm using the terms today. First, of course, we'll be talking a lot about evidence-based effective programs. So what I mean by that, and during the webinar today, is first of all that strategies have a strong research base and have shown reductions in substance misuse and related harms. So when we're talking about evidence-based effective programs, that's the category in which we're talking. And these are seen as, it says here, the gold standard for providing safe and effective programs. So these are ones that have been shown through research to be effective when implemented with fidelity. All right, so that's what I mean by evidence-based effective programs. When I say the word program today, I'm going to use that as a really broad term today. I'm going to include practices, policies, interventions, strategies, all within this global term of program today. I know sometimes when we talk about programs, we're thinking like packaged curricula, but when you hear that word today during the webinar, just know I'm meaning it as all encompassing for today's purposes. All right, and then in terms of the area in terms of the continuum of care for substance misuse, we are going to be focusing on primary prevention programs in terms of preventing something before it begins. So I thought, okay, let's see what other things we can think about would be considered primary prevention. And some photos here, hand washing. Hand washing helps prevent diseases and different illnesses, viruses from coming into our bodies. Eating healthy can help us stay healthy and strong. Exercising, of course, can be a primary prevention activity. Wearing helmets help protect our brains, a primary prevention of protecting our brains. And clean drinking water is something else that's a primary prevention kind of activity. So we're thinking about doing things, taking action before something begins. So that's what we'll be focusing on today. Yes, Mario, great. I see in the chat here some other ideas here. So yes, birth control is preventive too. Absolutely. It's preventing something from before it begins. Vaccinations, absolutely. What else? What else are primary prevention things? Go ahead and put that in the chat. All right. So let's move on to looking at where it will. All right, let's get going here. Come on, brain, let's fire. All right, where does program selection fit into strategic planning? If we're going to do effective prevention, this selecting a prevention strategy to implement needs to be done in the broader realm of doing some strong data-driven strategic planning. So let's look at this. Strategic prevention framework. Use the react. Those who are familiar with the SPIF, or if you aren't, go ahead and put a thumbs down, thumbs up, or heart if you are familiar with it, whatever you might be. Let's see some emojis coming up the screen. See lots of hearts, lots of thumbs up so far. Yep, okay, this is quite a few. All right, and feel free to say if you aren't, but it's looking like most people are saying yes. Okay, great. All right, so just a quick review, or for those who are not familiar with it, this is a strategic planning framework that consists of 5 steps: assessment, capacity, planning, implementation, evaluation, with 2 overarching concepts of sustainability and cultural competence. So why would we use a strategic prevention framework or any strategic planning? Because of course, that's the key to our success. It's the key to how we can be effective in the work that we're doing. And I put a note on here on the screen that selecting a program to implement using data-driven strategic planning dramatically increases effectiveness. So if we're just taking a program, and even if it's effective and evidence-based, just selecting one and starting it and implementing it in our community is not going to guarantee success, because it might not be the strategy or program that your community needs. So it's important that we do this work within the context of a strategic plan. So I'm curious, put in the chat, where is program selection in the SPIF? For those of you familiar with it, where is program selection found? Where's the work done around program selection in the SPIF? Go ahead and put that in the chat. Seen planning, I've seen throughout the SPIF, implementation, planning, lots of planning throughout. All right, any other ideas? Capacity, all of it planning. All right. Well, I should say all of you are correct, because it is found throughout the spiff. So planning is the step. I see many people say planning, that planning is the step of the spiff where you do the actual program selection, but all of the rest of the spiff, it gets impacted. It impacts how we select our program. And we are going to go through each step of the spiff. And sorry, I've got all the arrows here, but all the steps do impact how we implement, how we select programs within the context of our strategic plan. So let's look at each of these steps. So just quick reminder for some that of what each step is, and then let's talk about how it specifically impacts program selection. So step one, we are going to look at the data and identify the priority problems within our community around substance misuse. We're also going to collect our risk and protective factor data within this step of the spiff. So how does that impact program selection? The question we need to answer during this the assessment step of the spiff is, what is the priority substance misuse problem or consequence in my community? If we don't know that, that leaves it so broad. Of substance misuse is just, that's a huge broad area. So it helps us narrow down when we're starting to look at program selection, and what area of programs are we wanting to find programs. Did that make any sense? I don't think so. It didn't sound right in my head. So we want to know, when we go to do program selection, what area do we need to be looking at? All right, step two, capacity. In this one, as many of you probably recall, we are going to enhance our community readiness as needed, and we're going to enhance our capacity as needed. So what we need to know before we move into any kind of program selection is, what kind of communities is my community ready to embrace? Again, you can select a wonderful, effective, evidence-based program to implement within your community, but if your community is not ready for substance misuse prevention, it's not going to work. It's going to fall flat. There's going to be a lot of pushback from the community. For example, if your community is in denial that substance misuse is even an issue, then why would they embrace a substance misuse prevention program being implemented in your community? So what kind of strategies is your community ready to embrace? And then second of all, how much capacity do you have to implement prevention programs? This is huge, because you can, again, there are some evidence-based strategies that cost quite a bit to implement and or require a lot of capacity in terms of resources, of like people resources. The fiscal resources we need to think about, the people in terms of the personnel, and then also organizationally. So what kind of capacity do you have? That's going to really drive what kind of program you select to implement. All right, third step, which many of you said, which you are correct. If you see that second piece right there, this is where the actual selection of the evidence-based program happens. That is done after you prioritize risk and protective factors that need to be addressed, and then it's followed by developing an action plan. So what do we need to know in this step before program selection? Super important that we know what risk and protective factors we need to address, because again, that can help us filter out or really take this broad area of so many different evidence-based strategies and try to figure out which ones are most important and what would be most effective within our community. And then the second thing there, in terms of what we need to know before program selection, is the program effective and a good conceptual fit and a good practical fit? And we're going to talk more about those in just a little bit. All right, implementation step. This is when we mobilize support and build capacity for program implementation. So this is, we have the capacity step of the spiff, but then in this fourth step, we're going to, again, go back to that capacity building piece and build support and capacity for that specific program that you're going to be implementing. And of course, we want to implement fidelity and we want to monitor our implementation. So where does this leave us in terms of what do we need to know before program selection? is, first of all, will we be able to gain the support and capacity needed to implement the program? So as we're in that step 3 and actually looking at the program to select, need to take a good long hard look at will we be able to would we have the support and capacity to implement this? And will we be able to implement the program with fidelity? This is huge because what I see so many communities doing, they select a program to implement and then they go to implement it and they start needing to change things because they realize they can't implement it with fidelity. Or it might not be the appropriate program for their community, so they're finding they're being pushed to change things just to make it work within their community. So the will we be able to implement the program with fidelity is so important in that actual thought process around selecting a program to implement. All right, step 5, evaluation. We want to monitor the implementation, we want to improve the implementation, and we want to inform future decisions through all the evaluation work that we do. So what we need to know before program selection is, will we have the capacity to monitor and evaluate the program? So again, thinking about that as they're looking at the programs to select, it's like, okay, so what would this look like in terms of evaluation? Would we be able to monitor whether it's being implemented with fidelity? And will we have a way to evaluate the effectiveness of the program as it's implemented in our community? All right. So the SPIF overarching principles, couple of things to think about is in terms of sustainability, what strategies can my community sustain over time? So if we find that we're getting the outcomes that we want from the programs, would we be able to sustain it? Or do we just have one set pot of money that we can use for a year or two, and then there would be no way for us to sustain it? If there isn't a way to sustain it at that point, maybe look at, are there other programs or policies or strategies that could be implemented that would be sustained over time? And then the other piece of this, of course, is which strategies are responsive to your specific community's needs to make sure it's that you're responding to the specific community in which you're implementing the program. All right. So thinking about all that with all the steps and all the work we need to do that will inform our program selection, if we don't do that, if we do the program selection outside of any strategic planning process, what's the potential pitfalls of doing that? Go ahead and put in the chat. Any pitfalls you could see if you don't do program selection within the context of strategic planning. What do you think? Rachel says lack of buy-in. Yep, absolutely. You are no support. Not enough information. Yep, doesn't fit the need. Forget important details. Absolutely. These are fantastic answers. Yep. Absolutely. You all are spot on. Yes, frustration from staff. Absolutely. That is not on the list that I'm going to show you. I should have added that. Wrong program, may need to pivot and wasted time. Absolutely. So yes, I think you all have said everything that I had listed here. If you have not done this selected your program within the context of strategic planning, you may inadvertently select a program that does not address your community's needs, does not reduce the risk factors impacting your community's problem, isn't a good fit, and you might not have the capacity or readiness to implement with fidelity. And I think you all said all of those things plus other really great points within the chat. So thank you for adding those comments. All right. So if we are thinking about selecting I'm sorry, I've got my notes here. I want to make sure I didn't want to say anything else before. Nope, I'm good. All right. So let's move into the steps for effectively selecting a prevention program. And we're going to focus more specifically on step 3, which many of you said this is kind of a crux of when we're going to tie all that other information together into the work we're doing to actually select the program. So the 3 tasks, as we already said, within this step is to prioritize risk and protective factors, actually select the program, and then develop a comprehensive data-driven plan. Let's take a closer look at tasks 1 and 2. So task 1 is prioritizing risk and protective factors. During this time, you're going to take that data that you collected in step 1 of the SPIF, the assessment step, and you are going to use the criteria listed here to decide of all of the risk and protective factors that we know are the risk factors that increase the likelihood of substance misuse and the protective factors that help buffer the impact of those risk factors. What area do we want to focus on? And we can use the 2 criteria that are listed here to help us decide on that. So the key questions or key areas that you want to look at when you're looking at that data and deciding which risk factors to prioritize as well as protective factors is, first of all, the importance of how much a specific risk or protective factor affects a problem. So again, in the assessment step of step 1 of the SPIF, you're going to identify the priority substance misuse problem within your community. You'll want to look then as those risk and protective factors, which one of those, the ones that you're seeing prevalent within your community, are impacting that problem. So that would be the importance. And the changeability piece, the other piece of the criteria is a community's capacity to influence a specific risk or protective factor. So it may be really important to address a risk factor, but if you don't have the capacity within your community or ability to impact that risk factor, then that's that changeability piece. You might not be able to change that. You might not be able to impact that. So you're wanting to select priority risk and protective factors that have both high importance as well as high changeability. So that's that task 1 of prioritizing risk factors. You want to prioritize those with high importance and high changeability. All right, so that is task 1 of step 3 of the planning step of the SPIF. All right, so task 2 within step 3 of planning is where we are selecting our interventions. So a few things here. We want to first identify programs shown through research to be effective, which is what I'm going to help you identify where you can find that information. We're going to get deep into that next. And once you have a set of programs that you're interested in looking at, then you want to apply the criteria around conceptual fit and practical fit to decide whether or not a program is a good fit for your community. We're going to talk about those 2 concepts in just a minute, but let's first talk about whether or not, actually, I'm going to go back. So that first piece of identifying programs shown through research to be effective. Here's a great graphic from Putty, I'm not sure how to pronounce that person's name, Putty and Wilkins. In terms of where we want to be, is we want to be on this end of the continuum if we can at all possible be. So we want to select a program that is well supported through the strength of evidence, that it's well supported, model or exemplary, and that the effectiveness has shown is very strong in terms of the program or practice effectiveness. So as much as we can be, if we can get in this top left-hand corner, that's where we want to end up in terms of evidence of effectiveness for the strategies we're selecting. Now, sometimes when we're looking at our community's needs, there might not be the options to be up here in this corner. So that's when we want to try to be as close as we can to that corner, if at all possible. All right, so that first part in terms of selected programs is there evidence of effectiveness? And then we want to get into the fit of how good of a fit would these programs be for our community. So conceptual fit, and I have a little quiz for you after this, the next slide, so be ready. When I'm talking about conceptual fit, it's that the program is a good match for the job that needs to be done. So conceptually, do we think if for what we need done, is it going to be a good fit? So more specifically, does it address one or more of your priority factors, your risk and protective factors? So again, in that first task and within the step 3 of the SPIF, you're going to identify your priority risk and or protective factors. So when you start looking at the possible programs to implement, you want to make sure, will it address at least one or more of your priority risk or protective factors? Second, has it been shown to produce positive outcomes for the members of your focus population? So the folks that you are wanting to impact within your community, that you're wanting to involve within these programs, has it been shown to produce positive outcomes for the members of that community? And third, it's a good fit for the job that needs to be done. So I have a couple of images here. So let's say that I am wanting to cut a piece of wood. What do you think about needle nose pliers for me to accomplish this task of cutting a piece of wood? How successful do you think I'll be? Mario says, no, please don't. So I don't know about you. My dad, his only tool of choice was a hammer. So if it couldn't be fixed without a hammer, it wasn't going to be fixed by him. So in this case, he would not have fixed it. Yep. So unless maybe it was a tiny piece of wood, maybe teeny tiny, like I don't know, maybe. But yeah, not a good choice of a tool, right? Okay. So what about a saw? Would a hand saw, if I wanted to cut a piece of wood, be better fit? What do you think? Yes, much better. Yeah, absolutely. So it's the right tool for the job. And that's exactly when we're talking about the conceptual fit is we want to find the right program for the job that needs to be done. Is it a good fit for what you need to have happen within your community? That's the conceptual fit piece. All right. So let's see how well I'm doing at sharing information about this. We have a quiz for you that's going to come up, and there's 3 different ones, and I want you to put true or false for each one of them. So you might need to scroll down on there. And I'm going to go ahead and be quiet, but so true or false of whether or not these are good conceptual fit. We'll go about 1 more minute for folks to complete. And if you aren't able to do the poll, please do feel free to put your answers in the chat if you like, or you can just write them down on a piece of paper in front of you. All right, let's go ahead and end the poll and share the results with the answers. All right, so let's go through these one by one. An example of strong conceptual fit is selecting Botman's Life Skills school-based curriculum to address your priority risk factor of family management problems. In this case, this would be false because this is a school-based curriculum implemented within the school that's not designed to impact family management. Typically, family management problems would be addressed through parenting education type of strategies. So this would be, if you have a priority risk factor within that could be addressed within the schools, which is why you might be wanting to implement life skills program. Um, that would be a good conceptual fit if you had school-based risk factors or there are other risk factors that would be addressed by life skills. A life skills program. Come on, brain and mouth, connect, connect, connect. All right. So in this case, this would not be a good conceptual fit if you're wanting to address family management problems. All right, number two, an example of a strong conceptual fit is implementing a social norms marketing campaign to address your priority risk factor of community norms favorable towards drug use. True, absolutely, because we're shifting community norms with a social norms marketing campaign. Example of a good conceptual fit. All right, number three, a question that should be asked when assessing a program's conceptual fit includes, does it address our community's priority substance misuse problem? True. You are right. Yes, that's a good conceptual fit is if it will address your community's priority substance misuse problem. All right, well done, everyone. We'll go ahead and, yep, stop sharing. Any questions about those answers? Go ahead and again, I know Nicole's put in the chat reminder, you can put in the Q&A any questions you have. So please feel free to ask any questions you might have. All right, next. And I'm going to pause here for a second, see if there's any. Nicole, I don't think my Q&A thing is not showing up, but I don't think any have come in there. Otherwise, it would have popped up. Is that right?
That's right. You're correct. We're good so
Okay.
far.
Just want to double check. Thank you. All right. So conceptual fit. Now let's move on to practical fit. So practical fit, what we're talking about here is the program a good match for the people involved and the community overall? So is it relevant for the group of folks that you're going to be working with the focus population within your community? Does the community have the capacities to support it? Does it enhance or reinforce other prevention activities going on within your community? So it can be a good conceptual fit in terms of that last piece. It's like on paper, it's like, yes, it would address the needs that we have, but would it actually fit well within my community with how my community looks right now and the focus population that we have? So going back to my choice of tools for cutting my piece of wood in terms of the conceptual fit. A conceptual fit would be a handsaw could be a good fit for that in terms of cutting wood. The practical fit would come here. So would a handsaw be most effective or would a table saw be most effective or be a good fit for me? So in the case of a handsaw, if I didn't have much skills or experience with the power saws, or I have a really small job, or maybe it's a job where I wouldn't have electricity to be able to use a table saw, that could be a good fit for cutting a piece of wood. Now, what about if I'm needing to cut a lot of wood and I do have access to power and I do have access to the knowledge and expertise to use a table saw? The table saw might be a great fit for me. So going back to our evidence-based programs, one evidence-based program might be a really good practical fit for a community, while for another community, it might not be a good practical fit at all. So it depends on what the situation is within your community as to whether or not it's a good practical fit. So whether or not it's a good match for the people in your community and the situation in your community. All right, ready for another quiz around practical fit? Any questions before we go into the quiz? All right, let's see how I did at explaining that concept. Oops, let me go forward. There we go. And look at the poll and be sure to scroll down for the 3 questions on it. All right, about 30 more seconds. All right, let's go ahead and end the poll and share the results and the answers. All right, a question that should be asked when assessing a program's practical fit includes, does it address our priority risk factor? This is actually false. So does it address our priority risk factor is the conceptual fit piece. So conceptually, has that program been shown to impact that risk factor? So that would be that first step. That's what keeping these two separate, it can be a little tricky. So but that would fall within the conceptual piece. All right, an example of good practical fit is selecting a program for your rural community that was evaluated in Seattle, Chicago, and New York with the plan to adapt it to your setting. False. That's correct. 88% of you got that right. That would not be an ideal practical fit if they have been evaluated in urban centers and you are in a rural community. All right. Third, a question that should be asked when assessing a program's practical fit includes, do we have the resources to implement it with fidelity? Yes, 99% of you got that correct. You are absolutely right. That is true. Great. All right. So how are we feeling about understanding practical fit and conceptual fit? Go ahead and give me a thumbs up or a face, one of those faces if you're like, I still don't understand. Use those reaction emojis at the bottom to show me how you're feeling. I've seen some kind of, I'm not sure. All right, so it's a mixture. All right, I've seen lots of thumbs up, but a few folks that are feeling a little unsure about the two. Okay, so let's go ahead um, and look at. I'm going to go back. Come on, let me go back. All right, so conceptual fit is it addresses the prior, at least one or more of the priority risk factors. So you want to know, okay, I'm looking at this evidence-based program to implement. Will it actually address the priority risk factors that we have within our community or the priority risk factors? And has it been shown to produce the outcomes for members of my community or similar communities? So is it the right fit for the job that needs to be done? All right, so that's the conceptual fit. And when we go to, whoops, I keep going backwards. Sorry about that. And when we're going to practical fit, so it's like it could be good conceptually, but practically, is it relevant for my focus population? Does my community have capacity to support it? Does it enhance what's going on in my community? So the conceptual is um, on paper, if I was looking at the risk and protective factors that we want to address and the priority substance misuse prevention problem within my community, on paper, does it look like that could be a good fit? Then the practical fit is like, okay, on paper that looks good. Now looking at my community and the situation in my community, is it a good practical fit? Does that work? What do you think? Does that help? I see one thumbs up, helping. Seen a few coming in. Okay. That's helping, making sense. Okay.
Chris, we
All right.
did have a
Yes,
question just come in, if it's okay to ask a
absolutely,
clarification
please.
here. The question is asking, wouldn't we want the practical fit to address risk factors? Is what someone's asking.
Oh, and say it one more time, please.
Okay, but wouldn't we want the practical fit to address risk factors? It's a clarification Michelle's looking for.
Okay, so we want both good conceptual fit and good practical fit. So if it's good conceptual fit, that means that it does address the priority risk and protective factors that we want to address. So yes, we want it to address your priority risk and protective factors, and we want to have good practical fit. So good clarification question. We want both good conceptual fit and good practical fit. So let me know if I didn't answer your question. Go ahead and put more in the Q&A if I didn't. All right. Any other questions?
So yes, and actually I'll share this first one first because it's in line with the words we're saying. So someone is saying, I think there may be confusion. Um, I think the confusion may be the cadence progression of the conceptual fit. I think it's operating on the assumption that you first assessed a conceptual fit before the practical fit, but we haven't stated that explicitly. So just
Great
checking.
point.
Do you need to do one
Yes.
before the other is what's being asked essentially.
Yeah, I think that would be wise and probably most effective is to first, yeah, if you're thinking about a funnel, if you're looking at and funneling out to get to which program would be most the best fit for your community, is to first look at conceptually, yes, does it fit? And then that practical fit would be the next step. So I like that. Thank you.
Perfect. Perfect. Do we have time for one more? Just a
Sure,
one
go
more
for it.
pop here? Okay. So excuse me, the other question came up more conceptually, which I really love this question. It's asking, do you have any suggestions for how to help agencies or school systems understand that a program that they've always used is no longer effective and that it won't be funded?
I'm going to put that question off for because it's a great question and it involves a lot to answer it. And we're actually going to do a virtual training on this in March. We are probably going to post it within about a week, but it's moving communities away from ineffective strategies. And we are going to spend 2 hours. We're diving deep into that question. So thanks for asking that, Cynthia, because it's really important and essential work that we need to do to move folks away from ineffective programs. All right, is that it for now, Nicole?
Yeah, that's it for now.
Great, thank you. All right, well, we are going to move into, if you've been on these webinars, you will recognize that this poll, we have a new reporting requirement. So if you could go ahead and share on the poll, if you work in substance misuse prevention, what is your source of funding? And go ahead and select all that apply. And then once you are done with the poll, you are welcome to step away for a 5-minute break. All right, so we'll go ahead and get the poll done, then you can step away. All right, welcome back, everyone. Hope you're able to stretch your legs just a little bit. Get to move around. All right, I see some some hearts. You're able to get up and move, do something, let your dog out, pet your cat, say hi to a cubicle mate if you're in an office. All right. Okay, welcome back. So just a reminder of where we are at before we left the break. We're at SPIF Step 2, our Strategic Prevention Framework, Step 2, task number 2 of selecting interventions. And this task involves identifying programs shown through research to be effective and applying the criteria around conceptual fit and practical fit. So with that in mind, we need to figure out where can we find these possibilities in terms of these programs so we can determine a good fit for our community. We can determine their level of evidence of effectiveness and whether or not there's good practical fit and good conceptual fit. That's what we're going to turn our attention to now. So as I mentioned at the beginning of our webinar and also in the email that's sent out by Rebecca, we are going to be using this document from the Pacific Southwest Prevention Technology Transfer Center. It's the Online Registry's Guide to Evidence-Based Substance Misuse Prevention Programs, Practices, and Policies. Rebecca put in the chat a link to that if you didn't get a chance to download that yet, but please know that I'll be referencing this guide in the next part of the webinar. All right, there are 5 sections within this document. The first and second one are organized with this format. So they looked at what online registries exist out there that contain information around substance misuse prevention strategies and their levels of effectiveness. For each of these online registries that are included in sections 1 and 2, the information that's listed here on the screen is what is included for each of those. So who hosts it, so who's behind this website, the actual website address, the description of the type of website it is, who it was designed for in terms of the audience, the review and selection process of in order to get onto that website and be listed as effective or promising or whatever or whatever labels they give. What is that process? The topics covered in each entry. So when you click on a program, for example, on their registry, what kind of information can you get? What kind of search variables they have. That can be really helpful in terms of when we're searching for different types of programs to implement, and whether or not it includes environmental strategies. And that's a yes or no answer for those. So that's how the document is organized in terms of sections 1 and 2. It has each of these areas of information. I highly recommend that when you open up this document, like I said, there are 5 sections. 4 of those list different kinds of online registries. I would recommend starting in section 1, which is why they put it as section 1, is that these are the most applicable ones for substance misuse prevention and also have a high level of criteria in terms of being listed on the website in terms of showing the evidence of effectiveness. So I recommend starting here in that document. The registries included in this in section 1 is Blueprints for Healthy Development, the College Alcohol Intervention Matrix, also called College AIM, OJJDP's Model Program Guide, CDC's The Community Guide, Washington State's Excellence in Prevention Strategy List, the What Works Clearinghouse, and the WISAC Environmental Strategies Tool. So those are the different registries in section 1 that are listed with all that information from the previous slide that I said. We are going to take a look right now at these 4. So we're going to look at Blueprints, College AIM, OJJDP's Model Program Guide, and the Environmental Strategies Tool. So let's take these one by one. Blueprints for Healthy Development. So this was created by the University of Colorado Boulder Institute of Behavioral Science. I put here that's considered the gold standard of registries, that they had a high level of criteria in terms of what's required by research to be shown to show that these strategies, these programs, practices are truly effective in terms of when they're implemented with fidelity. They also could provide numerous options in terms of how you can search for different programs within the registry. This fourth bullet, this is important to know that it's currently not being updated due to loss in funding. This happened just quite recently. So at this point, I would say it's still pretty good. It is good information. There might be some links that are broken, but it's still solid information. But as time goes on, hopefully they're going to get more funding to be able to keep updating it. But at this very moment in time, it's not being updated. So let's take a look at it. I'm going to walk you around it a little bit. All right, so this is what it looks like when you click on the link. And what you see is right here, it says Find Programs. You can click on Find Programs and just let you know, whoops, don't do that. You are going to do an individual activity right after this where you are going to do a search on your own. So watch carefully as I'm going through and you'll be able to do the activity. So if you click on Find Programs, then when you scroll down here, you can click, these are the ways that you can access the different variables. So for example, with program outcomes, you could go to problem behavior. And let's say you're looking for your priority risk factor, or excuse me, the priority problem within your community you found is around alcohol. Then you could click on that. Excuse me. You can go in and you can select by age, gender, race, ethnicity, program specifics in terms of the type, setting, and continuum universal selective or indicated prevention. And you can select by risk factors. So, and you notice once I clicked on alcohol, that it automatically populated those that have been shown to be effective in addressing alcohol. So I'm going to go ahead, let's go ahead and pick a risk factor of, let's do favorable early initiation of drug use. So that pulls up 5 model and model plus programs and 4 promising programs. So you'll see as you click more, it's going to narrow down pretty quickly. Like if I click universal, let's see how many we get. So now we're at 4 and 4. If we decide to do an age, let's do, how about that one? Early adolescence. Now we're down to 3 and 4. So you'll see as you keep clicking on more variables, you're going to get fewer and fewer possibilities. But that can help you narrow it down. So this is the one way that you can start narrowing down that, here's this huge list of evidence-based strategies, programs, looking at conceptual fit. So the conceptual fit here is the program outcomes category. And if you wanted to start, I would start with that. And with the priority risk and protective factors within your community would be identifying the conceptual fit. And then practical fit, once you click on each of these, you'll see they have a lot more information around them. They have this fact sheet, they have program costs, so looking at your capacity to implement it. They have more evaluation information here. So lots of information that they have for each of the programs in their website. All right, so you get to blueprints, click on Find Programs. Then you can start selecting your program outcomes, click on the variables to see what kind of programs you come up with. All right, any questions about that in terms of how to get there and what this looks like? Awesome stuff, Salvador says. I'm glad you're excited about it. All right. All right, Nicole, any questions so far?
Not yet.
All right, very good. All right, let's go to our first activity then. We're going to put this in the chat. You see Rebecca put it there. We're going to take about 4 minutes. I want you to click on the link, and then I want you to do a search for those different things listed there. And we'll come back and then I'll ask to see what you've come up with in terms of programs that would fit these criteria. Okay, go.
We need a little Jeopardy music.
Some people like the quiet. And when you're done, if you go ahead and put in the chat done, just so I have an idea of how much time folks are needing. All right, about 30 more seconds. All right. And Candy, that's a great question. I went ahead and put in there that readiness is acceptable and capacity is adequate. Just as a somewhat of a catch-all of they may not have tons of money, but and their community might not be highly ready in terms of prevention, but they're somewhere in the middle. So if it's something that takes a lot of capacity and a lot of funding, that might not be a good fit for this community. All right. So what I would like you to do is go ahead and put in the chat one program that came up once you did a search for this, and let's see what people came up with. All right. Okay, but I came up with 4, and it looks like most of them, or I counted 3. I had 3. All right. So what I came up with, it looks like a lot of people came up with similar ones to me, but a few had some other ones. So we might have done the search variables a little bit differently. What I came up with was life skills training, which a lot of people had, positive action, and strong African American families program. So it looks like that that was mostly what you all got to. So with the others, I see if you got project towards no drug abuse, so or towards no drug use, excuse me. I didn't get that one, so we might have done a little bit different with the variables there. But the key thing here is I wanted you to get in there and actually start clicking things to see where they're at, so that you'll know once we are done with this webinar, you'll know how to get in there and use it. So thank you for doing that. Oh, and Candy, I also got multi-systemic therapy, but that one, I believe you need quite a bit of capacity and funding to implement. So that's why I didn't include that on the list. Excuse me. Um, so can I show my search on this? I can definitely do that. Let's go ahead and do this together. Well, let me click on that. There it goes. All right. So if we did this, find programs. So I want you all to tell me what would you do here? So if you clicked on, so the priority problem would be underage drinking. So I would go priority problem and click on what? Put in the chat. Which one did you click? Anybody? Great. Alcohol. That's what I did too. All right. So then that narrowed it to 20 programs. So then the next thing was the priority risk factor would be favorable attitudes toward alcohol use. So we go down to here, risk and protective factors. It's under the individual category. And favorable attitudes, then I do favorable attitudes toward drug use. Because they don't have anything, it doesn't say specifically alcohol use, but that would be included within drugs, of course. And that's where, oh, look at that. It is there now. I swear when I did it before, it didn't show up. I'm not sure why. So there, it's there. I'm so glad we did that together. All right. Okay, and showing this is helpful. That's good to know, Charlotte. Very good. Thank you. Thanks for asking. All right. So that's where we ended up with these five. And then multisystemic therapy. If you would go in there and you look at program costs, this is where you start looking at the startup development team is 11,000, 8,000 for subsequent teams. Then there's another 4,800. So there's licensing fees. So it's not a small lift to implement something like multisystemic therapy. So that's why I hadn't included it on my list. So then, yes, what about age? Maybe that's what I did before. Thank you. Gosh, you guys are on top of things. I am not, and that thank you. So age, you guys are so good. So that's what I did. I clicked on here. This is why I ended up without the project toward no drug use. Thank you, thank you, thank you, Tiffany and Emma. All right. Oh, and Jessica also caught that. So well done, you guys. All right. So any other questions about doing a search on blueprints? Nicole?
I was going to say one question came up about the number of filters you're using. So is it better to use fewer filters or more filters?
I would say I just do it one at a time and do the most important variable that you want to make sure that it addresses. So I would always start with the step one of your assessment of your priority. If you start with that, then next I would do risk protective factors. Then I would do the age, and then just keep clicking. At a certain point, you're probably going to get to too few programs to go much more. So a great question. Thank you. All right, so let's look at college aim. So for those of you, does anybody here work with college populations? Go ahead and do an emoji for a thumbs up or put in the chat. I've seen one so far. Yes, yes. Good. Oh, I'm so glad to hear that. Okay, great. So let's go ahead and look at College AIM. It was funded by NIAAA, and it's housed on their website. And there's not a search function on this, so it's a little bit trickier, but if you sit and look at it for a little bit, you can figure it out. And we'll go ahead and do it together. But it is focused on college students. If you need a refresher on how to do this, we'll talk through it now, but this is a great just 9-minute video that is really helpful to show you how to use this tool. So this one, you will see once you click on here, is not a searchable website. It is a document. So once you go here, this is the matrix. Then you can go, excuse me, the website. Then you can click on download as a PDF, and you will get to here. Then you'll just scroll down. There's the introductory information, but you'll see how it's laid out. It has a matrix of individual level strategies and a matrix of environmental level strategies. And then there's a summaries table for each of those. And then there's some great appendices in terms of a planning worksheet, frequently asked questions, etc. So if you work with college age folks, highly recommend downloading this document and really exploring it and digesting it. So let's go ahead and go down to one of the matrices. I'm sorry, I hope I don't make you motion sick as I scroll down. Close your eyes if you need to. I'll tell you when to open them up. Hold on, hold on, hold on. All right, and here we go. You can open your eyes again. And let me go ahead and make this screen lid bigger. Oh, I'm hitting plus and it's just making my chat bigger. Let's see if I do that. All right, sorry everybody. I want to go bigger just with this document. And it's not letting me. All right. Nicole, any hints on how, let me.
Oh, you see right above the top of the document, there's a little plus and minus.
Oh,
You see it?
my,
It's in a different spot.
the pictures were on top of it. I was like, I know it's here. Thank you. All right. Thank you. Thank you. Ugh, Nicole's my saving grace here. Okay. So what you will see is on this left-hand side is the effectiveness, the success in achieving targeted outcomes. So you see there's higher effectiveness. So the 3 stars is the highest effectiveness, moderate, lower, not effective, and too few studies to rate effectiveness. So that's on the left-hand column, left-hand side. And then across the top is lower costs, mid-range costs, and higher costs. So that's the least expensive to most expensive. And then on right here with this legend, this is where you need to study it a little bit. I had to take some time and really I had to refresh myself again. I've looked at this before, but so if you look on each of these that are listed, you'll see some different variables or icons to help you sort out what they mean. So the barriers to implementation, there's the higher ones would be the 3 pounds symbol, moderate and lower. Whether it's a broad approach, focused approach is B or F. The research amount and quality. So 4 is 11 or plus studies showing this information that's on here. 3 dots would be 7 to 10, 2 dots would be 4 to 6, and 1 dot would be 3 or fewer. And then the primary modality would be in-person individual is IPI, IPG is in-person group, online or offsite, and computer. Excuse me, I skipped over that. So that's what, when you go and you look at those with higher effectiveness and lower costs, you'll see 2 pound signs. So that would be moderate barriers to implementing. You'll see that it has a B there, which would be a broad public health approach. 4 dots would mean 11 plus studies showing this. And online or offsite is the primary modality. So that's the way to decode what's on here. So that was around normative re-education was all of what we were talking about there. So it's going to be a little bit more difficult than the clicking on with blueprints. You could just click on the variables and be able to go in and do it. This is not as user-friendly. However, it has fantastic information. So again, if you're working with college populations, highly recommend that you really dive deep into this document. And you can also, like I said, watch this video tour to get more information. I do have an individual activity for you. I want you to go look for these criteria. So individual level strategy, and actually we're running short on time. Let's do this together, okay? I know we put in the chat or what the task is. Let's just go ahead and do it together to make sure that we can do it. So I'm going to go ahead and go back to here, and here is our task. So we would want to go to individual level strategy. So that's what this page is, are the individual level strategies. The next page is environmental level. So if you go to that page, you would be in the wrong table. So individual level strategies, higher effectiveness the next criteria would be right there. Mid-range cost. So we go here would be mid-range cost. Whoop, it didn't let me highlight that. So this middle column here. 7+ studies. So again, if we look at our legend, 7+ studies would be 3 dots or more. All right, moving things around to do this. So 3 dots or more. And a broad public health focus would be a B. So we're in this category, 7+ studies, broad public health approach. Go ahead and put in the chat which of these strategies, and there's only one, would fit that criteria. Go ahead and put in the chat. Oh yeah, and you can just put the number of the strategy if you want. All right. Yes, you guys got it. This IND 26 personalized feedback intervention. It has a broad public health approach, at least 7 studies, and it's done online. I didn't specify that, but well done. All right, any questions about this document? Does it show the studies it pulled the research from? Good question. I'm guessing, like, if we go to this strategy table, I'm sure they are all researchers. So I don't know if in this document if they do. Supporting resources? I don't see it here. So I will look for that though. That is a great question, Candy, or no, Alejandra. Thank you. So we plug the wording in to find the online. So you have it in the slides that you have. You can click on there, or you can also go to, if you do, I'm sorry, let me go back one slide. If you put in college alcohol intervention matrix or college aim and NIAAA, you'll come up with this, but it's the collegedrinkingprevention.gov website.
Chris, I think what the person's asking is once you identify, so like for instance, people said ID-26, finding that actual
Oh, finding,
from the
yes,
document. Yeah.
yes. Thank you. Great clarification. Thank you, Nicole. Okay. All right, I'm going to keep going because I want to make sure that I tell you about this website because it's very different than the other ones in terms of it focuses specifically on environmental strategies. So if you're looking at implementing things like policies, laws, broad strategies, marketing strategies, those kinds of things, I highly recommend checking out the WISAC Environmental Strategies tool. And I'm going to show you real quickly what that looks like. So when you get here, you can click on view all strategies. See up here in this greenish aqua, what color would that be? Aqua. All right, and you will come up to this page and you can search by these variables. So now this one, again, you won't be able to layer the variables like blueprints. And so that's again why I have people start with blueprints, is because you can do, there's so much functionality to the website. But with this one, for example, you can click on I just want to know what the effective strategies are. And then that will pull up all the effective strategies. Or I want to know all about the ones that address community norms. And they go here. And then you can just glance down and look through to see which ones are rated as effective, not effective, or varied evidence of effectiveness. And then you could also do it by the substances, alcohol, other drugs, or tobacco. And what you'll see if you click on these is information, description of the strategy, discussion of the effectiveness, and then the references and evidence base and further reading for more information about it. So this is a great place to go if you're wanting to address, especially when you go here in terms of if you're wanting to address community norms or economic availability, if you're working on the enforcement of laws and policies that already exist, promotion of media, retail availability, and social availability. If those are some of is a priority risk factor that you're wanting to address, I highly recommend coming into this website and looking around to see what you can find here. So let's go ahead and do a search together like we did with the others. If we could go ahead and put in the chat, Rebecca, the instructions, these instructions. So let's find together an effective strategy. So I'm going to click here for effective. So I just want to see effective ones. That it addresses the risk factor of community norms. So this is where you can look along here, causal areas. There would be community norms. And I want to see a target substance of alcohol. So with this community norms strategy, this one has tobacco goal. So that doesn't meet my criteria. So let's scroll down, another causal area, community norms, and it shows alcohol. So this would be open container laws would be one example of a strategy that would address the criteria that I have here in the chat. Let's go ahead and scroll down a little bit more. So another look for a causal area around community norms. We keep scrolling, there's another one, community norms and alcohol. So healthcare initiatives would be another one. Let's scroll a little bit more. Community norms, alcohol, it would be graduated driver's license policies. So it looks like there would be 3 within this website that would impact or fit those 3 criteria that I put in the chat. Rebecca put for me in the chat. All right, any questions about using WISAC's environmental strategies tool? It's a great option to look for environmental strategies. All right, not seeing any. I'm going to just mention there's the OJJTP's model program guide. The focus here is really on juvenile justice and delinquency prevention. But as I'm sure you all know, many of the risk factors for substance misuse are the same ones for challenges with that they end up finding in the juvenile justice system, as well as delinquency prevention. So it can be a helpful website if you need to look for more options. All right, real briefly, there are 4 more sections to this document. So if you've exhausted the online registries with that first section, go ahead and move on to section 2. Section 2 has 3 registries. One is the CASEL program guides, the Collaborative for Academic, Social, and Emotional Learning. Second is this website, and the third is the Results First Clearinghouse database. So these aren't specifically focused, again, on substance misuse prevention. However, they might meet some of your needs if you didn't find those in any programs that met your needs in that first section registries. So the CASEL program guides, it's again, it identifies a rating of social and emotional learning programs that's designed mostly for educators. home B, this is for effective home visiting models. So if you're working on that family portion of the family risk factors, this might be helpful for you. Results First Clearinghouse. This is from Pew MacArthur, Results First Initiative. And this is looking at social policy programs from 9 clearinghouses. So this is kind of interesting that they pulled together these 9 different clearinghouses and pulled all of the information from them into this one database. So if you're wanting to look at something that's pulled in from all these different areas, might be a useful look. All right. And section 3, 4, and 5. Those, again, as you are needing more, finding what I need. Section 3 has some additional registries. The reasons they aren't included in section 1 or 2 are specified. That some are no longer updated. Some have few substance misuse prevention programs, and some are programs already included in another registry. So they duplicate what others already have. Section 4 has a really useful at a glance table. So if you're wanting to say, hey, just give me the basics, I just want to look through it all, go to section 4. It's a great summary of the information in the document. And section 5 are additional resources to help support you in doing this work. So I encourage you to look through those. So again, if you haven't yet, download this document, and then you would have the links to all these different websites and the information on all of these different websites. All right, and I'm going to keep going, and then I'll circle back to questions at the end, because I want to give you a few last tips. I would definitely start broad in your search and then get more narrow. So start one or two, start maybe 2 variables in your search, and then add more as you can, as long as you're still getting possible options as you add in the variables. I highly recommend, if you're wanting some more help in figuring out conceptual fit and practical fit and remembering what those are, go to SAMHSA's Selecting Best Fit Programs and Practices document and go to Appendix 1. So you might even just take that, print it out so you have it handy to review as a checklist. Really useful document. Some people might be saying, well, gosh, what after I do all of this, I can't find anything that fits. I would do these few things. First, adjust your search variables in terms of searching for a different priority problem that addresses the same priority risk factors. So let's say if it's alcohol is your main focus, but if you adjusted it to, let's say, cannabis, and the risk factors for cannabis are the same as alcohol, if they are, depending on the risk factor that you're looking at, if it's a risk factor for both, then you could go ahead and adjust your search variables to cannabis and see what you come up with. So go ahead and search for a different priority problem that would address the same priority risk factors. You might need to go back and look at increasing your capacity and our readiness. If you're finding that, gosh, what we need to accomplish, we can't accomplish with the capacity and readiness that we have. So we need to take that step back to step 2 in our SPIF planning process and really focus on that for a little bit before we select a program to implement. You can also look at considering evidence-informed approaches if you have, as long as you can have a strong evaluation component. So this would be if you know that the theories behind it are really solid, they're based on research-based theories, then that might be something you can look at doing, but I would highly recommend you have a strong evaluation component if you do that. All right, so thinking about moving forward, I always like to give you guys a few ideas of things that you can do following the webinar to put this information into action. I always start with have a water cooler chat, because when you talk about the information you have just learned, that helps really cement it in your brain. So if you have the opportunity to talk to somebody about it, you could even talk to your dog about it or somebody else, but just saying the words and having to formulate and figure out how you would say it would be really helpful. If you haven't yet, download and print that online registries guide that we used. Review your needs assessment to identify your priority risk and protective factors, and then check to see if the programs you're implementing have been shown to impact them. So that's that conceptual fit. Go back and check the conceptual fit of what you're doing. Print out that appendix 1 so to help you do have a checklist of the conceptual and practical fit. Review your strategies you're implementing regarding their evidence of effectiveness. Go to blueprints, start there and see if they're on there. If they aren't there, go to some of the other registries and see where they're at. You can also watch, if you didn't get a chance already to participate in that webinar, the Uncovering What Does Not Work webinar, and or read the lit review that we have on it to make sure you aren't implementing inadvertently any ineffective strategies. All right, and to wrap it up, a few upcoming events. On the 24th of February, we are going to do a webinar on Hire Smart, Hire Strong. So if you do any onboarding of substance misuse prevention professionals, highly recommend you attend that. Tokens are for arcades, engaging youth in prevention in a meaningful and purposeful way on February 26th. Be your own Spielberg, using storytelling techniques to create and highly engaging and impactful presentations. If you present at all in any way to community members, to your coalition, to students, whoever it might be, highly recommend that you attend this training with Brian Kloss. I will be presenting the last in this series of Foundations of Prevention, the last webinar on logic models. And so if you're wanting to learn more about how to implement logic models, really taking all this information we've been talking about and creating a really solid logic model, we'll do that on March 10th. March 17th and 18th, Nicole is going to be leading a training on prevention supervision. So if you supervise anybody who works in prevention, highly recommend joining in. And last but not least, we have a few more slots left for our Sustainability Planning Intensive Training course. Priority is given to Region 5 folks for that because we have a limited number of slots. And with that, we'd always love for you to follow us on LinkedIn and Facebook. That's how we get information out every day to you. And don't forget to complete the GIPRA evaluation. Once we log out of here, you'll be redirected to it. I read every single comment, so it's really helpful for us to know how well this went for you. And with that, a huge thank you to you all, and to also Rebecca and Nicole for all the great work you did in the back end of this to make this successful. And a huge thank you to you all for your active participant. So much easier to do these kinds of trainings when you all are so actively involved. So thank you, and I hope you have a wonderful rest of your day. Take care, everyone.